Hello, I am Dr. Chandrika Shekhar, working as an obstetrician and gynecologist at Chirag Hospital, P Nagar 2nd Phase. I am also a visiting consultant at Malti Manipal Hospital, Jayanagar 9th Block, Apollo Cradle Hospital, Jayanagar 5th Block, and Motherhood Hospital, Banshankari 2nd Stage. Instructions after a caesarean section, that I would call it. That is a routine thing that is happening, and in today's society, too many ladies are having caesarean section for deliveries. There are some people who are opting for caesareans because it is more easier, because there is no stress of labor pain and all those things. And there are incidences of caesarean also increasing in society because of various causes. So after caesarean, what should we do? I'll tell you instruction what we have to do after caesarean. In caesarean, we cut open the abdomen and we try to remove the baby that is in the womb. So when we are going to cut the abdomen, we have to cut so many layers. First thing is we'll cut the skin, and under the skin we have the subcutaneous tissue, that is what is fat, all it is full of fat only, and after the fat comes the fascia, that is the fibrous tissue that is covering the muscles. Then again we cut that fibrous tissue, then after that we get the muscles. In muscles we do not cut the muscles because damaging the muscles is not a good thing, so we try to split the muscles, we try to open in between the muscles and go into the abdomen. Then we get the peritoneum, which is a very thin layer and it can be cut. Then after the opening of peritoneum we get the uterus, and uterus is a organ which is full of muscles. The uterine wall is full of muscles, uterine muscles. So we cut open the uterine muscles and then we remove the baby. So nowadays what we do when we are doing caesarean is, in olden days we used to open the caesarean in a line, in a vertical line. Nowadays we don't use that vertical line because there are so many advantages of opening the abdomen in a transverse lower abdomen line, because we call it as, we try to give them a bikini type of incision, so that when they wear the bikini their scar will not be seen. In olden days it was not like that. It was all puckered scar and the whole abdomen used to look so ugly. So it used to be vertical scar. Nowadays we don't do this vertical scar, we always do this transverse lower abdomen scar, and because of that so many advantages happen. One thing is it is less painful. Second thing is complications are also less. The complication that was commonly happening was hernia, incisional hernia, which has been drastically reduced after accommodating this lower abdominal transverse incision. So what is the things that you have to do after caesarean? See, immediately when I go to see a caesarean patient the next day, we'll see that she has to move, because when we make them move, that is the most important thing for a lady. More she moves, more faster she recovers, and we'll be avoiding so many complications. So I want my patients to get mobilized the immediate next day after her operation. So what I would do is, I would like to give a support for her abdomen, because when she has emptied her uterus because of removing the baby, she will not be able to move easily, because the uterus is like a small ball like this inside the loose abdomen. So when she gets up, the uterus will move like this, and the whole abdomen is a loose bag. And when she feels something fell here, she'll be feeling insecure even to sit and stand. So that will make her mobility less, and she'll tend not to walk or tend not to sit. So that is not a good thing after the caesarean. So always I'll recommend caesarean patients to wear abdominal binders, so that they'll get a proper support on the incision, on the cut surface. So if they're having that security, first thing is they'll have less pain in their surgical area. Second thing is they'll be able to more easily move, and more easily movement, you can make them more easily walk. And once they walk, they can take care of their babies properly, they can take care of themselves also properly, so their recovery will be very faster. So that's what I have seen nowadays post caesarean. By following these instructions, the recovery of caesarean patients are very fast compared to what was happening 20-25 years back. And one more thing is, after caesarean, what is the thing is, I told you, we have to remove the uterus in so many layers. So when we are removing the things in layers, there is no proper support for the abdomen. So you cannot lift heavy weight. See, it will take some time for all the insides, cut surfaces to heal. Till it heals, we have to take care that we should not do very rough things which can hurt the abdominal layers. So most common thing is lifting heavy weight. So we would recommend a lady who has undergone caesarean not to lift heavy weight for a few months. Okay, so pakka healing will happen over a period of 5 to 6 months. So we would tell them usually not to lift heavy weights. That is one thing. Second thing is, one thing you all must know is, there is nothing in sitting or squatting down on the floor. Nothing happens for caesarean patients, because all the patients, they go when they are getting discharged, they tell that we do not have the Western toilet, ma'am. We have Indian toilet. Can we sit and use that toilet? You can absolutely use Indian toilets. There is no problem with Caesarean. Okay. So you can use the abdominal binder so that you will feel more secure. So you can even climb the steps. You can sit down and squat, because in olden days I have seen before, when I came newly as a doctor, so many doctors, they will not allow the patients to sit down after Caesarean, because that is a damaging thing. It is just damaging your whole life only, because they should be able to do everything. So that time they will not feel that they have undergone Caesarean. There is no need to avoid anything. Only thing is some small precautions you have to take, and you can do everything. You can sit down, you can sit on the chair, you can sit on the sofa, you can use Indian toilet, you can Western toilet, you can climb the steps, you can lay down, nothing is going to happen. And you can carry your baby also easily, because when you are having Caesarean, your baby also grows gradually, not that one day suddenly it will become big. So slowly your abdomen will also be healing. So as it grows, you will be able to lift your baby normally. That's what I tell for people after Caesarean section.